Welcome to the 2013 Ventricular Assist Devices Awareness for Staff. You may wish to test your browser for compatibility. Review this slide to successfully complete the course. The objectives of this course are to describe the purpose of a ventricular assist device, VAD. Identify the basic components of a VAD. Name the physiological differences of a VAD and a non-VAD patient. And describe the protocol for treating a VAD patient during a code. A ventricular assist device, VAD, is a mechanical pump that's used to support heart function and blood flow in people who have weakened hearts. The ventricular assist device has resulted in the survival of many people. One of the most famous VAD patients today is former Vice President Dick Cheney. Since former Vice President Dick Cheney has received his heart made too, heart failure patients have been more aware of this alternative therapy. There are several types of ventricular assist devices on the market today. Here at University of Kentucky Medical Center, we use mainly the HeartMate 2, Thortec PVAD and the Total Artificial Heart, but we'll treat any type of VADs that come into our facility. Currently VADs are primarily for adults, but we will soon support our neonate and pediatric patients. There are 4 major components of the HeartMate 2, implantable pump, controller, battery clips and batteries. Other LVAD gear that a patient has is an extra 3 sets of batteries, module, universal battery charger and backup controller. Support gear is known as Go gear. This involves a vest and pouch, consolidation bag, accessory bag, and shower attachments.
The HeartMate 2 is a small...
The system controller has 2 controller boards, one for the primary system and one for complete backup system operation. It has automatic event recording and data logging capabilities. It records and stores pump parameters during all alarm conditions. In addition, the data logger can be set up to record pump parameters routinely at a preset interval from 30 minutes, 1 hour to 24 hours, in 1-hour increments. This must be turned on and set up using the System Monitor Save Data screen. It will store a total of 120 events, this includes alarms and non-alarm events. Then we'll erase the oldest and store the newest. Batteries will last for 12 to 16 hours per set, and weigh about 1 pound each. Each battery has a light, which indicates battery charge level. The universal battery charger is a rapid charging system for the lithium-ion batteries. It will fully charge 4 batteries in 4 hours. The power module is an AC power supply that runs off of house current. It can provide 30 minutes of backup power during a power failure, and has a backup 12-volt adapter for use while in the car. The patient uses this reliable source of power during the night or any time the patient is sleeping. The system monitor is hospital equipment only. It is used to change the pump's RPMs, download historical events recorded by the controller, and displays flow, RPMs, pulsatile index, and pump power. The display module is a read-only display, and is used by the patient while connected to the power module. No pulse. Most patients will not have a pulse. If a pulse is present, it will be weak and could be irregular. No blood pressure. Because of the left ventricle being unloaded with the blood pump, and thus reducing the overall left ventricular pressures, the aortic valve will be challenged to open well every beat. With most LVAD patient, the aortic valve will only open every 3 to 4 beats. Most patients do not have an audible blood pressure, and have a narrow pulse pressure. That is 90/80. A Doppler is required for most patients to auscultate a blood pressure. Most patients will only have a mean arterial pressure, which sounds like a swooshing sound, that is barely audible near the expected systolic point. Unreliable pulse oximetry. Because of the weak or pulseless condition, pulse oximetry cannot be trusted. One should rely on visual cues. Is the patient pink, warm and dry, or are they short of air? Blue or gray? If the controller makes a continuous and loud shrieking sound, this alerts the patient that emergency action is required. In most cases, both batteries have been disconnected or the power source has failed. The result of a power failure is that the pump will stop, and the patient will immediately become symptomatic. The HeartMate 2 primarily uses sound as a warning mechanism, to alert the patient to either cautionary changes in the LVAD, or emergency notifications requiring immediate attention. When the HeartMate 2 controller makes an intermittent beeping sound, this alerts the patient that some sort of maintenance is needed. Most of the time the patient will only need to change batteries, or switch to an alternate power source. Deterioration response. VAD patients may need specialty interventions when their condition changes. The MCS response team has been developed to meet those needs. Contact beeper 330-7671. If external defibrillation is necessary, leave the pump running. Do not disconnect the system controller from the percutaneous lead before delivering the shock. Warning: in the event that the LVAD has stopped for more than 15 minutes, retrograde flow may occur. And non-circulating blood in the pump can lead to risk of stroke or thromboembolism, should the device be restarted. Chest compressions are allowed for a clearly symptomatic patient. If the pump is not functioning or it obviously is not providing the support needed to perfuse the patient, chest compressions are then required per BLS and ACLS guidelines. There may be risks associated with performing external chest compressions in the event of cardiac arrest, due to the location of the outflow graft and the presence of ventricular apical anastomosis. Performing external chest compressions may result in disruption of the aortic anastomosis, or dislodgement of the LVAD inflow tract. Clinical judgment should be used when deciding whether or not to perform external chest compressions. You should now be able to describe the purpose of a VAD. You are able to identify the basic components of a VAD. You can name the physiological differences of a VAD and a non-VAD patient. And finally you can describe the protocol for treating a VAD patient during a code.